Hello, everyone. I'm Judy Regensteiner. I'm professor of medicine and director of the Center for Women's Health Research. I am so glad to be with everyone tonight, although it's certainly a different way to be together. This is our first online Let's Talk, reformulated in response to the COVID-19 situation. Our goal eventually is to get back to meeting in person, but right now we're happy just to be able to reach out to so many of you tonight. I want to thank you for coming. For those of you who are new to us, the Center for Women's Health Research has been a center of the University of Colorado School of Medicine since 2004, and we partner with UC Health to bring these programs to you. Our mission at the Center for Women's Health Research is to do the cutting edge research in women's health and sex differences across the lifespan, and we focus on cardiovascular disease, diabetes, and mental health as it impacts physical health. The second part of our mission is to train, fund, and mentor the next generation of scientists, male and female scientists, who are physicians and PhDs who want to study the important area of women's health and sex differences research. We need that workforce, and we really are passionately devoted to mentoring our young scientists. And third of all, we want to educate the public and our healthcare providers so that everybody knows the best possible evidence-based information so that women's health is treated, and men's health and the family's health all get the best possible evidence-based treatment. Again, we are very excited to be with you here tonight even under these circumstances, because it's a way for us to continue to reach out and provide good information. Our areas of focus really do not include COVID, and we will have further programs that will focus on our main areas of research. But right now, this is such a compelling area that I feel it's very important to bring you this program, which is focused on mental and physical effects of COVID. One thing I should tell you is that the National Institutes of Health, which is the biggest funder of biomedical research in the country, had presented some data recently where they showed that of the 210 countries that have reported on COVID results, only 18 reported those results disaggregated by sex. So a lot of times we don't even know how men and women are affected. And really what we know is that women may not be as severely affected in terms of the disease and do not die as often, tragically, as do men. I mean, tragically, men die more often. I should put that a little better because that's horrible. But women suffer a lot of the gendered effects of COVID, such as, dealing with the bulk of childcare, losing jobs more frequently, and there are other issues as well that my colleague, Dr. Helen Coons, will be addressing. So both sexes are being hard hit by the virus, and even children are also being affected, although to a lesser degree. So we want to bring you this talk to share with you ways to cope, ways to help your health. And we're going to follow our three speakers with a question and answer period. Our first speaker tonight is Dr. Becky Scalzo, who's a young scientist supported by the center and other sources. She's an assistant professor in the Division of Endocrinology, Metabolism and Diabetes at the University of Colorado Anschutz Medical Campus. The goal of her research is to better understand how type 2 diabetes impacts women and men differently. She's particularly interested in the effects of diabetes on skeletal muscle and how exercise can be used as a therapy with those living with type 2 diabetes. I asked Becky here, though, for a different reason tonight, not to talk about her research, which is compelling and exciting research, but to talk about how a young scientist's life is being impacted by this virus. And it applies to really all of our young scientists. All of us are working from home currently. They're trying to get us back to work in a safe and effective way, but it's certainly not fast, nor should it be. However, the impact of this on many of us is hard, and as it is on the public as well. So I'm going to turn the, I'm not sure what to say, microphone over to Becky to give our first talk. Becky?
There. Successfully did my first objective of the evening and turned my video on. Thank you, Judy. I appreciate the opportunity to be with everyone this evening from my home office and discuss my experience as a working mom with young kids during this COVID-19 crisis. Before I begin, I do want to acknowledge that my family is lucky in our current climate. We're healthy, and my husband and I have been able to keep our jobs, and I recognize that that's not the case for everyone. But even without those added stresses, simultaneously working from home, parenting, and teaching has really left me feel like I'm constantly putting out fires. My plan for this evening is to start with some of my background to give you context of how the COVID-19 shutdown has impacted my life as a working mom, share some of the strategies that I've learned after things went terribly wrong in the beginning of the COVID-19 shutdown, and end with how things are going now. So to start, professionally, like Judy said, I'm an assistant professor of medicine at CWHR, a research scientist at the Rocky Mountain Regional VA, and a Center for Women's Health research investigator. The general focus of my research, like Judy said, is to understand how type 2 diabetes impacts men and women differently and the role that exercise plays in treatments for type 2 diabetes. My long-term professional goal is to make living and exercising with type 2 diabetes easier for people with this disease. To work towards this goal, my professional routine before COVID was a balance between data collection, meetings, and writing. My favorite days were those spent in the lab doing experiments, interacting with research volunteers, and meeting with our research teams to brainstorm ideas and opportunities. When our campus shut down, my data collection completely stopped. All of my meetings moved to Zoom, like I think happened for most people, and writing grants and papers became the primary focus of my work to-do list. Personally, my husband and I have 2 little girls. Bryles is 7 and in the 1st grade, and Charlotte is an energetic 4-year-old. My husband, Jim, is an emergency communications supervisor for the Sheriff's Department, and his job is always considered essential, but during this time is considered essential and must be done from the Sheriff's office. At the same time that our campus moved to remote working and schools closed, Jim's work schedule pulled him out of the house more than normal. And most days he's home for breakfast and the morning routine, but then gone past bedtime, leaving me responsible for the majority of distance learning while also trying to work remotely. When working from home started, I really thought that this time was going to be great for me to catch up on my writing. I'd be out of the office and away from those distractions, so I wrote myself a very ambitious to-do list that I called my coronavirus break. Yes, I knew that schools were going to be out for a couple of weeks, but our teachers had anticipated this prospect and had sent home packets of review work to keep kids engaged and occupied. And I consider myself a good multitasker. I think a lot of us think we're good multitaskers. So I didn't think juggling work and school and parenting all at the same time for a couple of weeks was going to be a big problem. Like a lot of my friends on social media, I too wrote out a schedule on my whiteboard for our days. So I would be able to get my work done and the girls would get what they needed and wanted. I made sure there was going to be academic time and time to be outside and playing and everything in between. We had a plan and I was confident that things were going to get done. But as you can anticipate, things didn't go so well. Specifically for me, I barely got any of my work done, specifically my writing projects. Writing for me requires uninterrupted stretches of time to concentrate. And the 30-minute blocks that I had set up for the girls were too short for me to get into any kind of a writing groove, and they were really too long for kids their age to be expected to focus on one task. Sometimes the activities for the kids that came from school or came from some well-intentioned social media posts that I saw required quite a bit of hands-on help from me, so that didn't help me get my work done. Or when I did identify things that would keep the girls occupied, I had to save those for all of my Zoom meetings. At this point, I'm convinced that my kids have a sixth sense for when I need to be most occupied during a meeting, and that's when they decide to come barging into my office asking for a snack or telling me they're bored or something else that just really makes it hard to work from home. After 2 weeks of trying to put out all the little fires that kept popping up, parenting, teaching, writing, meetings, phone calls, everything that was going into my day-to-day life, I honestly completely broke down in tears with my mentor over Zoom, because that's what we do these days. We use Zoom for everything. I acknowledged that I was overwhelmed and trying to teach and parent while also trying to keep teach and parent and trying to keep up with my kids' schoolwork was just too much. And I felt like at every turn I was having to choose between my kids and their schoolwork or my work. And like most parents and most moms out there, you pick your kids first. So to do that, I was falling quite far behind in my work productivity. And that was really upsetting for me because I derive a lot of value from my job. So at that time, thankfully, my mentor is quite wise, and she helped me recognize that I am not working from home. I'm not working remotely. I'm working during a crisis, and I needed to change my expectations on how that was going to go, and to recognize that nobody was expecting me to write or do more work from home than I had been doing, than I would be doing in the office. And quite honestly, the opposite was expected. So after that talk, I made some pretty significant changes. I erased our whiteboard. I love a to-do list though. So instead of a schedule, we now have a checklist for every day. Make sure that we do our schoolwork and we get outside and we're physically active and creatively active. But we now have the flexibility to choose when we're going to do those things. You know, if it's a nice day and the kids want to play outside, we'll make it work. If I have 7 Zoom meetings, we'll make it work. The other thing I've done is taken the advice that our teachers have been giving us the whole time. Do what works best for our family. Our teachers have posted a lot of activities to try and move the school year forward, but with the idea that we weren't expected to do everything. And honestly, I was trying to do everything. I've realized that that was harmful for me and probably for my kids' mental health. So now we're just not doing some of the activities that are posted, and that's okay. I've also reset my work expectations. My new goal is just get a couple of good hours of work done every day. I get up early and work until the girls get up. And some days that's an hour and some days that's a couple hours, depending on when they decide to make their presence known. But this way I feel like I do get to focus and have my time for a little bit of the day before I transition to working on our school day. The other big change I made was to my exercise routine. I'm a runner, and it's just as much about the physical aspect as it is about the mental aspect. So it's something I really need to get done every day. And in the beginning, I was trying to run at the same time as Browse would ride her bike. But that really wasn't giving me any kind of the mental break I was craving. So switched it up. And the minute the girls wake up, I put my computer away and I'm out the door to go for a run. And I let Jim handle the morning routine and breakfast with the girls. And this is working really well because it gives me some time alone, which I crave. It's allowing me to put a fixed barrier between my focused part of my workday and our school day. And it also gives Jim some extra time with the girls, which I think they all really enjoy. So things are better, but as distance learning and work from home continues, I find myself feeling more and more burnt out. From a professional standpoint, I'm not getting to do what I consider to be the best part of my job, working within a team, getting to interact with them in person, and really having some variety in my day-to-day professional tasks. I'm on Zoom a lot, and it just doesn't recapitulate that in-person interaction that I enjoy. And I've also learned that these interactions are what fill up my mental bucket and give me the creative energy I need to write the papers and grants that are on my to-do list. From a personal standpoint, I'm just flat out exhausted. When I do have the opportunity to focus on one thing, I find myself worrying about another fire that's burning in the background. You know, am I adequately preparing Browse for second grade? Will there be second grade in the fall? What effect is the shutdown having on the girls' social development? And it's not worrying about my kids, I worry about my parents because they're in an at-risk group, and I worry about what's going to happen if they get COVID-19. I also worry about their mental health with the isolation that comes with these stay-at-home and safer at home mandates that are coming from the government. When I'm not worried about those things, then I turn around and worry about my professional development. You know, how long can I professionally stay afloat while keeping everything running at home? So to conclude, that's not, I'm concluding on a sour note of saying I'm exhausted and burnt out. But at this point, I'm just trying to hang on, take advantage of resources when they pop up, like my mentor and getting her advice, or these kind of opportunities like the center's Let's Talk series, but also trying to remind myself that I need to provide myself some grace as I navigate this crisis. So with that, I'll turn it over to some experts so it'll help us with our mental and physical health.
Hi, and thank you, Becky. That's a very moving discussion of what you're going through, and many young scientists are going through this, and many people around the country, not just scientists, everybody, as we try to adjust to an unimaginable situation, really. So I personally believe that things will get better, and I'm looking forward to that time, but it isn't overnight. I know that, and it's very difficult. A lot of our young scientists are stressed by this, and it's a hard time, especially for parents of young children. I wanted tonight in this program to focus on both physical and mental health, because I think you can't really have one without the other. And our next speaker will address the aspects of physical health primarily. Dr. Amy Huebschmann is an internal medicine physician at the University of Colorado School of Medicine and at UC Health. She's an associate professor of medicine and lead scientist for community outreach at the Center for Women's Health Research at the Anschutz Medical Campus. She is trying to develop in her research, she's a researcher as well, also a mother of 2 young children, but in her research, she seeks to develop new evidence-based programs to promote healthy behavior. Thank you so much, Amy.
Absolutely, Judy. Thank you for the kind introduction. So I'll be talking on the physical health side of things, and then I'll be enjoying passing off to Helen Coons to talk more on the mental health aspect. These are my objectives for today's talk. I think the picture at the top sort of says it all, that people are running as fast as they can to run away from COVID-19 and trying to stay as far away from it as possible. We're being asked to do that by our government, and we personally feel it's important. I think when you look at the polls of Americans, most people feel this is very critical. However, my talk today is going to be addressing how this can have an unintended negative consequence, that if we're limiting our engagement with the health system when we actually need to connect with the health system around our physical health in particular is my topic, this is very risky. This is dangerous to limit our contact. So I'm going to go through some appropriate methods to seek help for medical needs and also highlight the dangers of not doing that. Then I'll try to leave on a more upbeat note with some simple and fun ways to be physically active during safer at home times. So this graphic is meant to lay out for you what we could consider 4 phases of how patients engage with healthcare. On the far left side, there's an awareness phase where I have some new or worsening symptoms. Maybe I should get some help for this. And you're thinking this over as a patient. Is this important enough to get help? Then the phase of medical help is when you contact the health system, you decide to actually reach out. This can be a phone call or going to the ER or sending an online portal message. Then the treatment and care follows from there. And this last phase is part of what my end topic is on sort of just proactively staying healthy. The physical activity bit I'm going to do there is more how we continue to proactively stay healthy. But I'm going to begin this talk thinking more in these 2 far left-hand side areas of when I have an awareness of some symptoms, when do I go forward and get medical help? So what I'm showing here is that you're considering 2 things. The pros are, well, I'm a little worried about something. There's something happening here. If I reach out and get help, that means I'll be able to get, some information about this. I can figure out what to do. But the cons are, is it worth it? Are there some negative pieces to this? And when we're not in COVID-19 times, these are more things like, will I seem foolish for asking for help about this? Does this not seem like it's important enough? But in COVID-19 times, this is taking on a whole new flavor where the cons are people are considering where the medical help lies and where the treatment and care lies, they're squarely concerned that COVID-19 is there. And if I go over there, what happens? So it's really raised people's perception of the cons. I think to the more so than it should. It's really exaggerated the risk of contacting the health system. So I'm going to give a couple of vignettes or stories about this. So I was on call for our clinic last month in April when we were still in safe at home times. I'll tell you, fun inside look as an on-call doctor. Usually people calling out outside of clinic hours, it's usually for mild illness symptoms. They're often debating, do I go to urgent care or could I wait to be seen in the office on Monday? Those are the types of things that I field on a usual on-call week. It was completely different this time around. Patients were much sicker who were calling me. And the plain and simple reason I was getting a lot of sicker patients calling me is they were asking that question, is it worth it? And they weren't really sure. And even, previously they wouldn't have called me. They would have just gone to the ER. But they were more worried. They had greater sense of potential risk of being seen and getting medical help. So 2 of the patients who called me got emergency surgery by the next morning. When I had checked the chart, they had already gone to the operating room. These patients, including the ones who needed emergency surgery and others who needed to be seen, were really reluctant to go to the ER. They were saying, we were talking it through and I was like, well, it sounds really important, starting to talk through how we're going to seek care. And they would say things like, well, I'm a goner if I go there, with my health conditions, I really don't think I can do that. So I really had to talk them through and take time to settle them down, to explain our processes in the ER and how we keep patients separate. If you come in and you don't have symptoms of a cough or anything that could relate to COVID, you're whisked away to an area that's, not got other COVID-19 patients. And we're, even in the units where we're evaluating for COVID-19, we're doing sterilization, cleaning like mad, using bleach like it's going out of style. So we're really doing our best to make it safe for people to come to the ER. This was necessary for these patients to go in, and otherwise I don't feel like they would have gone. So what I'm speaking to is this bias against seeking care for emergencies. And I just want to say that you're not safe at home if you're having an emergency. You need to go seek care. This picture I really liked from the Denver Post showing that our ERs, rather than people sometimes think they're overwhelmed right now, they've actually had much less people coming in just because of these fears. So I'm quoting a statistic here that there was a 50% decrease, ERs had half the volume of patient visits in March and April. This is despite the COVID-19 cases that they were managing. And this has a downside because people, naturally needed to come in for things, but they were staying away because they were scared. For example, in April, there was a 60% decrease in hospital admissions for stroke. That doesn't mean we were having less strokes. It means that people having stroke symptoms were not coming to be seen. So this is a major concern. Here's another example. This is delays for patients seeking help for a heart attack. So this study that was just published went through and compared patients who were evaluated and diagnosed with a heart attack in March of 2020 as compared to the year prior. And what they found was a 4-fold delay between the time patients reported their symptom onset of heart attack, whether that's chest pressure, discomfort, shortness of breath, nausea, sweating, other symptoms. That symptom onset and when they first came to seek help and were seen in the medical system took 318 minutes instead of 82.5 minutes as the average. I will say that our goal is that from the onset of symptoms to when you're in the ER is 30 minutes or less. We want people to be calling 911 right away. So even 82 minutes wasn't great, but you can see a much greater delay in this situation with COVID-19. I'd like to play this up as my recommendation, which actually is kind of a classic recommendation in the health field when doctors are in training. We advise each other, never worry alone. If there's something that's bothering you, you're not sure about a case, what's going on, you need to get more information. You need to talk to a colleague and run it by them and see what to do. So I'm saying as patients and people considering new symptoms, have an awareness of symptoms, never worry alone. Seek our help. Reach out to us as the doctors and the nurses in our clinics. Call. If you're not sure, call and talk to us so we can go through the scenario with you. We want that because in an emergency, you are not safer at home. These are just a couple of quotes from some doctors who are saying that they're really concerned about this scenario. And I thought the one in particular about patients who are staying at home and trying to diagnose themselves or playing down their symptoms. That's that idea of, is it worth it? I'm talking myself out of it being important because I'm biased against seeking help. That is another tragedy of this disease. So here's my safe ways to seek help that I've got listed out. You know, we do in-person visits and telehealth. We can do all of that safely. And we want to do whatever is going to be best for your needs. So if you don't have an emergency symptom, we just want to keep up with your chronic illnesses or address some new symptoms that aren't urgent to emergent, we can do things like that by telehealth often if they don't require physical exam. And we're really good at triaging that right now. We've moved a lot of our care to telehealth and online care. In my clinic, we've been doing 90 to 95% of our visits by telehealth online over the last 2 months. We still bring people in. I was in clinic today and I saw 2 patients in person who needed to be seen. We couldn't do the things for examination and lab testing over video or the phone for them. But we can do telehealth for a lot of things. So seek our help. And then the in-person visits, we triage, we bring people in when they need that. And emergency departments, as I mentioned earlier, we are doing our best to keep patients safe when they come to the emergency department. Our health workers are using protective equipment to protect them and patients. And I'll tell you, we've done a really good job of not getting health workers infected in our hospital. So I say that also does a good job of saying we're not getting you infected as patients when you come here. These are a couple of other key takeaways of when you're not safer at home. Just a reminder of certain emergency symptoms where you shouldn't wait, you should just call 911. So the heart attack graphic we have here, I kind of like this because it shows different areas of the body to think about if you're having a heart attack, where they might be. So pain or discomfort in the chest, which can just feel like pressure or burning. It doesn't always feel like pain. Lightheadedness, nausea or vomiting, jaw, neck or back pain, discomfort or pain in the arm or shoulder, and then also shortness of breath. So any constellation of these symptoms can be a heart attack. Severe and profound fatigue is another one that for women in particular can be an issue. For stroke, I wrote out the act fast symptoms that we think about with a stroke. So a new facial droop as the F, new arm weakness as the A, difficulty speaking as the S. Double vision or major vision change isn't part of the mnemonic, but then the T means time to call 911 if any of those things are happening. And again, I'm going to hit my point of never worry alone. If you're not sure what's going on, it's not clearly an emergency to you, we want to hear from you. All right, now I'm transitioning to some fun stuff. And these are some ideas for being physically active in the safer at home times. As I mentioned on my earlier slide, you know, there is this key point of being proactive in our health, in our physical health, in addition to having an awareness when we have new symptoms. And this proactive bit is really key. Many experts are saying they're really worried people are becoming more frail in these quarantine times because they're sitting around the house a lot. And we know sitting is actually really unhealthy for you, very bad for your body. So I'm putting forth here some fun and safe things you can do. It's really key that it's fun because otherwise you're not going to do it. I'm reminding you about wearing a mask if you're out in public. Gardening, we've seen the gardening stores have had a renaissance with people wanting to do more gardening. You can do this in your yard or your patio. So this is a fun thing you can do. Being active, you can envision these 2 women are 6 feet apart, or that they're family members. So they're walking closer together because they're in the same household. This was pre-COVID-19 as well, since they're not wearing masks. So you can kind of pencil a little mask on them for your own ideas. These are some other fun and safe activity options. So there's some exercise videos. I'm showing pictures here like this class. You wouldn't go to an in-person class right now, obviously, but there's many different people who like an exercise class and like that environment. You can find a lot of that online, so you can do the exercise you like along with the class, but just put it on your TV or your computer instead. The American Heart Association and Fitness Blender both have opportunities for people of different ages and fitness levels, so you can find something that works for you. Also, the American Physical Activity Guidelines has guidance where you can create a personal physical activity plan, go through various things to find something that works well for you. And these were a few tips from their website: walking the dog as a family, calling a friend while you're taking a walk, taking your coffee and going on a walk. Then in particular for older adults, the National Institute of Aging also has many different activities to help our seniors stay active in ways that are going to work for if you have some arthritis or other things that limit you. They work with all of that and also try to make things fun. This start slide in the middle is for people who haven't done anything for a while and want to get started, and helps them work through a plan. These are some resources that we have also posted on our website, so that it's got basically the some of the resources I went through on the physical activity I posted here. If you're not sure if you might have COVID-19, or you're wondering if you should get tested and what to do, the CDC's website has information there. And finally, if you're interested in some telehealth or getting urgent care from our University of Colorado Health system, I've got the web link for that so that you could connect with us if you need to seek help.
Thanks, Amy. That was great. And I think it's so important. I've heard a lot of stories about people not going in when they needed medical care, and please don't do that. It's not safe. And as you heard, we have ways to make sure that you're safe and when you're getting care, and that you get the care you need. Please don't be afraid to get that care. I always worry about that. Women are particularly likely not to get the care they need. So make sure that you all do, and you men too. Our last speaker tonight, and then we're going to have a Q&A period right after that, after Dr. Helen Coons, who's a clinical psychologist. She's a visiting associate professor and the clinical director of the Women's Behavioral Health and Wellness Service Line in the Department of Psychiatry. She's a board-certified clinical health psychologist with over 25 years experience and a national leader in women's health and mental and psychosocial oncology. You know, her work is so important, and I know that she has been giving her all to go around and help with some mental health preservation techniques to colleagues and patients alike. So thank you, Dr. Coons, and I'll turn over the floor to you.
Well, thank you, Dr. Regensteiner, and thank you so much for your very generous introduction. It's a pleasure to work with all of you this evening, and I've been asked to speak about women's mental health and well-being during COVID-19. How do we build our resilience, sustain our resilience for the short and long term? So I think it's important to remember that as we have this conversation, this very brief conversation, and think about resilience, that we need to consider that women have higher rates of anxiety and depression in general before we even think about the short and long-term consequences of our pandemic. In fact, women are about 2.5 times more likely to be depressed globally. COVID-19 is certainly a global and national threat at so many levels, personally, professionally, to our families. We all sit with marked uncertainty. Many of us sometimes feel like we're on hold. It's hard to plan. It's hard to plan at work. It's hard to plan at home. Many of you aren't sure what to do about your children over the summer. Will they be returning to school in the fall? What will your college-age kids be doing? It's hard to have sustained uncertainty. In addition, so many of us are grieving at so many levels. Life as we knew it, the spontaneity of picking up a pizza and going for a movie, not thinking twice about jumping on a bike, seeing your best friend, playing bridge, whatever the example is. In addition, we're grieving a sense of safety and certainly grieving the loss of so many of our friends and families, locally, nationally, and internationally. We are only beginning to think about what the short and long-term consequences are, whether they're financial or physical or emotional or for family. I've stopped using the phrase during and after COVID because we don't really know what after COVID means anymore. I think it's really important as part of our conversation to also recognize that there are marked gender differences in the professional and personal impact of this entire pandemic. And I wanted to take a minute and just reflect on several examples with all of you as a group. First of all, women are more likely to be essential workers, and this is especially true for women of color. In addition, we're at risk for greater financial impact. While many of us have the privilege of steady incomes or good retirement or partners who have incomes, others don't. We're much more likely to be in part-time positions. We're at greater risk for having no or lesser benefits. As all of you know, we're certainly continuing to experience pay inequity and have less incomes or salaries, even in the positions that we do have. And this is even more so true for our sisters of color. We're less likely to have retirement savings. As Maria Shriver talks in her very insightful report several years ago, so many women are on the brink and not being able to make their next rent or their mortgage. We're much more likely to be single mothers, and as Becky mentioned, have multiple roles. We're more likely to be caregiving, whether it's young children, older adults, or ill relatives, with all of the health and mental health consequences for our multiple roles. I think most of you know we're also more likely to be at risk for interpersonal violence, which sadly has gone up in the context of COVID and all the stress and increased drinking that it engenders. And 70% of nursing home residents are women. So I just wanted to highlight that many of the challenges that we talk about for everyone, there are a series of issues that are more pronounced for women. As I continue to speak, I'd like you to think about how COVID-19 has affected your own health, your own mental health, and your own well-being, and make some notes as you have thoughts about our conversation this evening. I think it's important to recognize that we actually are coping very, very well with this a global and very alarming pandemic. What's important to recognize, though, is that doesn't make this experience not difficult. Even when we're coping effectively, this is very, very hard. I wanted to highlight just a few areas where we're particularly more likely to experience challenges. First, sleep. Our sleep quality and quantity may change. Many of us are having distressing dreams, and some individuals are even having nightmares. As a result, there are a few people who are sleeping a lot more, but many people still say that they're physically exhausted. And Becky, you referred to that in sharing your story. And actually, many of the themes that you shared with us are highlighted in this slide. Many individuals feel like they're emotionally depleted. Some individuals feel anxious or scared, more sad, sometimes depressed. Many individuals have noticed that they're more irritable, frustrated, and even some individuals are angry. Some of us are having a harder time concentrating, whether at work or on all the many challenges that we have at home, and are consequently less productive. We know that a subset of couples are having more relationship conflict. As my late mother used to say, she had married my father for life, not for lunch. We're not often used to having everyone around in the way that we do now. In addition, a subset of society is drinking more, which oftentimes engenders disinhibition and more conflict. Many of you may just feel like your physical and your emotional fuel levels, and for others of you, your leadership fuel levels are a lot lower. So I wanted to invite all of you to think about your fuel levels. And we used to talk about put your oxygen mask on first, but I don't feel like the analogy is a very good one here, given the nature of COVID. So let's instead talk about your emotional and physical fuel levels. Think back to where you were after the New Year. How were you doing physically and emotionally? What was your energy like? And where are you currently? You might take a moment and pause and rate both your physical and emotional fuel levels back in early January and where you are today. I've been asked to help you think a little bit about what it means to improve your well-being. How do you increase your sense of resilience in the midst of a crisis, an ongoing pandemic? First, it requires intentionality. And I love that Becky was able to allow herself to stop and reflect that what was going on wasn't working for her, and became very intentional about shifting how she was taking care of herself and her family. There are many, many components to our sense of resilience and our feeling of resilience. I want to just highlight 4 of them this evening: connection, our own wellness or care plan, healthy thinking, and meaning in our life. So first, connection. Now, there's no chance on earth right now that we should be sitting at a table like that. And I reluctantly used the slide, but the reason I kept it is the sense of pleasure and the sense of connection of these three gals. Isolation has repeatedly and more recently, once again, been shown to be associated with poor mood, physical concerns, as well as immunologic problems. So I'd like you to think about the three C's, the three ways to connect safely. And by the way, the three C's don't stand for milk chocolate, dark chocolate, or white chocolate. Instead, they stand for seeking contact, creating connection, and deepening our communities and our sense of community. And while it may be predominantly virtual that we do that, I really would like to invite all of you to pause and take a minute and think about how you would operationalize, how you would, in essence, seek more contact, create connection, and deepen community, even with the challenges we have while we're safer at home. What's your own wellness plan? Most women are incredibly effective at thinking about the well-being of their family, their children, their partners, if you have one, other members, but we're not so good at stopping and really thinking about our wellness plan. And I want to again applaud Becky for stepping back and thinking about where she was and where she needed to get to, even though you're still exhausted. So do you need to improve your sleep? Generally speaking, if you're not sleeping pretty well, you have trouble falling asleep or staying asleep, we'd really like you to reach out to your primary care provider or to one of us in the mental health field after 4 or 5 nights when you're up. We can't underestimate the importance and effective impact of aerobic exercise on our well-being. It's one of the best ways to restabilize sleep, quiet us down, not to mention the extensive list of other ways in which aerobic exercise helps us, whether it's walking or biking or doing an online video. And I appreciate that not everyone on the call is able to do that. But for those of you who are, we really encourage you to jack up your aerobic exercise to get kind of hot and sweaty at least 4 or 5 days a week. Heads up with the comfort eating. Many of the women we've worked with have noticed that they're gaining weight because they're self-medicating with food. So there's nothing like the feeling of good nutrition, some good sunlight, and less alcohol, and certainly less pot. So we invite you to think about just some examples of a good wellness plan. Finding COVID-free and gadget-free time. Using healthy distraction, whether it's a great movie or a stupid movie or a good book or a puzzle or a game. Very intentionally using quieting techniques. Consider the Calm or Headspace app, or just quiet, low and slow breathing. Considering writing, it turns out that we have decades of data now about the benefit of journaling, even briefly, to improve our health and well-being and our immune function. Becky, you mentioned wanting more time alone. When we interview women, there's no question, many of us want some quiet time to ourselves. And that's very healthy. And, not but, we also want contact with friends, family, and colleagues. It's important for everyone to learn to ask for support. No one said that we needed to hold up the world by ourselves, and to find some time just for yourself to take off. Just a heads up on negative thinking. It's tough to feel resilient if we're constantly feeling guilty or ruminating. Ruminating is very different than problem solving. Ruminating is something that we're actually more prone to do as women, and we're very good at it. Unfortunately, it's one of the factors that tends to contribute to our having higher levels of anxiety. Sadly, we often become very critical of ourselves, and often, and this makes me very sad, still consider self-care as selfish instead of self-respectful. So I invite all of you to think about shifting your thinking. Invite yourself to ask the question, can I have a different perspective on what's going on? How do I problem solve instead of ruminate? Can I set limits with individuals who are wanting to overly focus on everything that's negative? Remember that self-care is respectful. Do you have compassion for yourself the way you do for others in your life? This is certainly a time that requires not only cautious optimism, but finding moments of hope and gratitude and grace. One of the key parts of resilience is also a sense of meaning. So it's not often, since we're so busy and multitasking, that we pause and think about our priorities. Are we purposeful in how we use our time? Are we intentional about our physical, emotional, intellectual, and leadership capital, even during a crisis? And are we making the connections and staying and reaching out to those who we most love and love us? So what strategies are helpful to maintain or improve your own physical and mental health? What strategies are helpful to increase your sense of control and resilience at a time when we're so stressed and overwhelmed? For those of you who would be receptive to mental health care, we really encourage you to reach out, ask your primary care provider for referrals. You're welcome to call our service, Women's Behavioral Health and Wellness. You're welcome to reach out to the outpatient psychiatry service. Your insurance company may often be able to help you with referrals. And if you're in crisis, please consider the hotline as well as the National Domestic Violence Hotline. I hope that these brief comments have been helpful, and I'm really excited to turn the program back to Dr. Regensteiner for some questions.
Thank you, Helen. That was tremendous. Really helpful. Thank you, all three of you, for a terrific program. It was great. I now have a lot of questions, so I see that you have questions in the chat box, so I will ask the panel to answer these questions. I see one question that says, I'm receiving a lot of messages encouraging telehealth from my doctor and health insurer, but I'm not hearing much like Dr. Huebschmann is talking about encouraging folks to come in for urgent conditions. Do you have suggestions, Dr. Huebschmann, on how this can be better communicated? Oh, by the way, the question writer says you had a great presentation.
Well, thanks for buttering me up.
Wasn't mixed, no. But it's true.
Well, thank you, Christy, for the question. I think honestly, practices and health systems are trying to shift this messaging right now. And I think what I had said is important. I'm going to type an answer in here as well, which is I'm copying it from our UC Health page of what we now have just put on there on the UC Health page, and that should show up for everyone to see. But basically, what it says is we're open and we're ready to help. And it's saying that we have, all of our different clinics and urgent cares and ERs open for business, but we also are doing telehealth when appropriate. So I think this has been a shift in messaging because in healthcare, we're realizing there's now this other epidemic of patients not getting care for symptoms when they really are not safer at home. They do need to get help. So I can just say that at least that's the messaging UC Health has just started using that I actually think resonates with my talk.
Next question to the panel. The person asking the question says she's 80 years old and high risk. She has a lady that comes 3 times a week to help as home care. She's helping the lady with errands, shopping, and cleaning. Her kids are giving her a hard time about getting home care. This resonates with me as a person who has a 91-year-old mother who lives in another state and without whom her helpers, she couldn't get through. She couldn't function. So what do we tell people in that situation?
I mean, maybe I'll take it for a moment, but I'd love to hear Helen's comments as well here. So I think, like Judy just said, we have to look at what our needs are and what we need to do to stay healthy proactively. And what I'm hearing here is that there's actually some needs that this questioner has that this person coming 3 times a week is providing. So if we said don't bring in the help anymore, then what do we lose? So I think that I would lean towards mitigating the physical health risks by just wearing masks and being cautious and being socially distanced when this person is coming into the house. But you could still talk with each other because this connection piece, I think, is also probably a nice piece of this person coming in. So Helen, maybe you could speak to that bit.
Yeah, I won't repeat what you said, but I think you're right on. I would add that as long as there's, good safety around masks and gloves, that this is vital. We have an elderly adult who's isolated. And any age, isolation is extremely serious predictor of adverse mental health, both health, mental health, and mental health sequelae. And so I think the alternative is, how would this individual care for herself if there wasn't an aide coming in? And is the family prepared to take on that role in a safe way? And so I actually, without knowing more details, potentially it's actually an invaluable service at this time. Obviously, we don't know more of the context, but on the surface, it's very important both for the individual to have the services and the contact, as long as it's safe.
Thank you all. There's another question here. Can you address what is known about the gender differences with respect to COVID in terms of symptoms, severity, and lethality? Amy, probably you.
Sure. Yeah, I'm happy to take that. So in terms of symptoms, severity, and lethality, you didn't ask about who's getting it more or not. You know, the original data in China was suggesting maybe there were some difference in who was getting it, but a paper just published in Lancet is suggesting that the incidence, or how many women and men get it, is pretty similar, it seems. The severity is different. And there's some leading theories on, and Judy alluded to this earlier, the sex differences versus the gender differences. So in China, again, in particular, there were more smokers who were men who were getting in and had worse outcomes. We know that your comorbidities, or what else you have besides your age, matters a lot on how severe the symptoms are. So that's one thing, and those things can vary by gender to some extent. In terms of the sex difference, just biologically, the immune system response seems to be different between men and women in a way that is more harmful for men than it is for women. So the immune response that men have means that their illness, it tends to be more severe than it does for women. So that's one piece that is a sex difference. Others want to add anything in addition? And I can put the Lancet article link in the chat.
Just that the only thing I would add is that because there's been so many studies that haven't looked at the data in sex differences ways and comparing them, I think there's a lot we don't know yet, and that we will still find out. So
I would completely agree. This is early returns information.
Okay, next question. How do you handle conversations and interactions where the other person or people only want to talk about COVID? Suggest some ways to pivot from the negativity while connecting. I think that's a very good question, because it's pretty pervasive.
So this has come up a lot, and actually healthcare providers go home, and then everybody's and their families are calling them. But this is true for many people who just want to go on and on. And it's absolutely fine to set limits and just take care of yourself that way. And said, to say to someone, I'm great to talk for about 5 minutes, and then I really want to ask you, it's been a long day, need to kind of connect with you about some other issues, whether it's, hey, what are you doing about X, or how's your grandson, or how did your meeting go? It's okay to sort of set that limit and take control over that. And if the individual keeps coming back and saying, wait, this is our COVID-free time, I really want to hear about that, or get your input about this. Or, you mentioned you read that book, so go ahead and change the subject and just quietly, respectfully. And if they're still not getting it, you need to say, hey, I'm just really saturated with COVID. I can't go there tonight. I'm so sorry. You're asking great questions. I understand the CDC has a great website on that. But so sometimes we just have to be gracious but clear. And sometimes we have to do it a couple times. And sometimes there's individuals who just still can't respect that. Just don't take their call if you can when you're really saturated. It's okay. Or find a time to talk with them for just a few minutes and say, I'm so sorry, I've got a meeting. And it's okay to take care of yourself that way.
Another question, a question from a person who asked, her 98-year-old father lives with her and her husband. Both the husband and the questioner are in their 60s. she canceled her mammogram and her pap smear this year because she doesn't want to become a vector of COVID within her home. Would you encourage people to go for their physicals if they are experiencing no problems at all, or would you encourage these types of office visits and the risks those entail?
Yeah, so I'm happy to take that one. So I can tell you, I was in clinic today, and we did at least 2 telehealth annual wellness visits today for my patients. So, it's sort of had this misnomer of the annual physical, but a lot of what we do in those visits does not require a physical exam. So I would certainly encourage things that are not urgent, including annuals that could be done by telehealth to pursue them that way. Now, obviously, the mammogram and the pap smear we can't do through a video screen, so that's a different story. I would say that that's going to have to be a decision that you would seek help on from your doctor, because it really depends a lot on what your baseline risks would be. People who have a strong family history of breast cancer, maybe who had an abnormal mammogram a year ago or 6 months ago that was recommended for a PEAT one, that's a totally different story than no family history, normal mammograms all along, have gotten them every year. So some of it depends like what the timing previously has been. So would definitely say it depends would be the answer for those types of elective procedures, in my opinion, and seek help from your doctor.
I have another question for Becky and for Amy particularly, and also for Helen, but Becky, you take it first. I'm the person asked with type 2 diabetes, and I used to do water aerobics 3 or 4 times a week. Can't do that now. What do you suggest for a person to do who has type 2 diabetes where exercise is so important?
Anything that they can do to keep moving would be the best thing possible. If I know a lot of people enjoy water aerobics because it's easier on the joints compared with walking. But if you can get out and go for a walk, that's really the best thing that you can do for yourself. If you need to wear a mask to feel comfortable or walk at off times to avoid people, that's probably better just for general health and safety at this point. Riding a bike is great if you've got one and you've got safe places to bike. If not, there are a lot of resources. I know Dr. Huebschmann put them up on resources for exercise at home, but I've been amazed at how many YouTube yoga videos there are. I think there are lots of options. Just kind of find what works best for your body and stay moving as much as possible.
What about getting a haircut for people 65 in this time of COVID? The answer to that is that we don't really know. I mean, it's getting a haircut isn't going to take place from 6 feet apart. So the way they're doing it now is that everyone wears a mask and there's extreme caution taken, but we don't really have firm data one way or the other right now, unfortunately. And I know a lot of people need a haircut, so I understand that. We have one caller who says, I'm participating from New York City where the mood is dire and we have heavy-handed government. What does one do to stop feeling managed or dominated? We are all envious of the relative freedom in Colorado, which is an interesting perspective because, Thank Helen.
So thank you so much for your question. And I think what it reflects is first that you're in one of the most difficult parts of the country and in fact the world. And second of all, no doubt have lots of people in your life who are impacted by COVID and including yourself. The second is the diversity of perspectives on recommendations and policies that have been recommended by state and federal governments. And this group isn't going to answer that for you, except to say that it's helpful, I think, to step back and become highly informed, as Amy has mentioned, and look at the data yourself to evaluate your own risks, to remember that it's not just about our risks, but those around us. And you never know, not just because you don't know how old someone is, but the person next to you may be immunocompromised. and you may never know it. And actually, we've had several examples of that within my own team, that until this happened, none of us would have ever known that two of our colleagues were severely at risk. And so it's important to step back and use the reliable information that is out there from reliable sources, respect science, and get some perspective for what you feel comfortable with. And in a way, empower yourself that way to offset those feelings of being managed or controlled. I don't think we have easy answers for you, but to remember that you just don't know who's around you. And I think the other piece of this that's very difficult is that people are at risk for exposing us even when they're asymptomatic. And so when we back off of precautions, especially in areas where there's very, very high rates of viral load, we really do increase our risks. And so then the question is, how can you empower yourself and take control in other places of your life when you do want to respect safer at home? So I'm going to stop there, but I thank you for noting that there's a great deal of diversity in experiences and perspectives. I don't know if Amy wants to highlight more of that.
I think we have to stop.
Go.
Unfortunately. This has been, we have many more questions, but we are out of time. And I'm really sorry. It's been a wonderful evening, and I thank our three panelists. And I know there would be loud applause if we could hear it, but we know that it's felt. The Center for Women's Health Research is pleased to have presented this program tonight, and we will be presenting further programs. Please turn to our website and for lots of information, including all the sites that were named by our speakers tonight.
And Judy, can we keep the Q&A open for a minute? I'm happy to go through and answer some of those if people wanted to stay on to see an answer to their Q&A or no.
Our site is shut down at 7, so
Okay.
I can't.
Got it.
But we'll be doing further programs, and I really appreciate this a lot. This is our website, www.cwhr.org. And thank you very much for joining us tonight. You were great. And thank you so much, all of you in the audience, for joining us tonight.